This issue of From Washington is being done on Friday, January 17th, 2014. There has been more activity on transit in the last week here in Washington than we've had for quite some time. We've had hearings in both the T&I Committee in the House of Representatives, and we've had a hearing in the Banking Committee on Transit Reauthorization as well. The information from both of these sessions will be forthcoming to you on our larger information system that we'll be sending out. But in the meantime, let me say we're very concerned about some of the issues that were raised during the House hearings. We've heard, again, some older arguments about whether or not transit investments are overly subsidized as opposed to highways, which are, quote, already paid for. These were some of the issues that emerged last year in the House of Representatives in an effort to remove transit from the trust fund allocation. In the Senate, we heard more positive information from members of the Senate, and we heard concerns and questions raised about the lack of adequate capital and funding for transit in the current appropriations bill and its need in the next reauthorization. As part of our response to the entire issue, we've pretty much completed our review of priorities for the next transit reauthorization, should there be one, and we'll be sharing them with you at our next board meeting next month. We think these will all be very timely suggestions as the debate on the needs of transit and the future begins to take place. Having said that, and making note of the fact that Congress in fact did pass an appropriations bill this week, I have my doubts, as to many others, whether we're actually going to get to a transit reauthorization this year. As you know from last year, we had a great deal of difficulty with Congress and their scheduling, and this year promises to be an even shorter schedule than last year, since it is an election year and members of Congress will want to be gone more than here to take their message to their home communities. In the budget arrangements that were made by both the Senate and the House, we still have significant shortfalls in important programs that interface with public transit, especially in human services. And as you know, Congress has been unable to extend unemployment benefits during this period either. So it does appear that although this part of the appropriations bill will get us through the election, there are many possibilities to upset the legislative schedule in the year ahead. So we'll be continuing to work and provide information on a possible reauthorization. And as I said, we can discuss that when we meet next month about issues that will be important to us should the process begin to move forward in a serious way. Last week, we also had the news that Administrator Rogoff will be leaving the Federal Transit Administration to be taking up a undersecretary's position on policy. All of you who know Pete know that he has been very interested in policy issues and items, and it is not unusual at this phase of an administration during its second term to make these kinds of changes. So we'll be interested to see what happens in the filling of the FTA administrator's position, and also to see how these priorities for the FTA work with the new Secretary of Transportation in the immediate future. The administration in general remains committed to doing something on infrastructure. And as all of you know from following the political news, this has been a central theme of President Obama's for the last several years. And it's going to remain a theme throughout this year, especially in the run-up to the election. Across the country, we've also had a significant amount of discussion in the last several weeks about the medical transportation aspects of NEMT. Several states who have Republican governors who are now beginning to move into the Affordable Care Act have asked the administration to delete the transportation benefit for the expanded Medicaid population. except for those individuals who have frail health conditions and those who have other forms of disabilities. We're continuing to watch this closely, and earlier today we met with our friends from Simon & Company, and we will be publishing an article shortly on the importance of maintaining the benefit. The people at CMS in the leadership on the affordable care programs have advised the states that if they ask for these waivers and limiting the transportation coverage of the expanded populations, it will only be for 1 year. During that period, there is discussion about measuring the impact of not having these services for those that are covered by the waiver. We're disappointed that the administration has decided to grant these even short-term requests to defer the transportation benefit. Although I understand their desire to get Republican governors to commit to expanded Medicaid, we still believe that the absence of a transportation benefit to anyone covered by the program creates a series of access issues, especially for those who need treatment transportation as opposed to general access. I think that in the year ahead, we're going to see some initiative and discussion about changing the dialogue of the medical transportation program to reflect the fact that half the people who are users, according to recent information, really need the service for treatment and not just general access. In addition to that, we had a discussion today with the profound effects on Medicare's ambulance services in the last 2 years in terms of increased costs because people are scheduling emergency trips because they don't have non-emergency access. So we're hopeful that some of the new individuals at CMS who are handling these interchanges will be willing to work with us to craft a better solution to reduce the emergency cost by increasing a commitment to non-emergency. One of the things that we can say about the disruption of services for the newer population is it has raised the issue positively for us about the need for the benefit. We'll be trying to build on that in the immediate future, and you should be looking forward to seeing a working paper we're putting together shortly. In addition to all of these issues, we are also about to announce some major initiatives to improve financing for ride sharing, especially van pools, and for optional services like telework. I think you'll be seeing those in the next 2 weeks, and we're looking forward to working with our members to provide additional kinds of support for transportation in the year ahead. Looking forward, this will continue to be a year of challenge, especially when it comes to financing with these lower federal allocations, especially for capital. And we're hopeful that our newer efforts to provide financing will be part of the solution. For the last 6 months, we've been experimenting with different ways of financing medical transportation through the transportation services being provided by the Massachusetts Area Transit System in Massachusetts. As many of you know, MART, which is a public transportation system, operates the statewide medical transportation program there. So we've been working with them in how to better provide services that make it easier for the transit community to provide active leadership and participation in medical transportation. Hopeful that we'll have some news for that for you when we see you next month as well. Finally, this is the first week that our member, Dan Dirks, has been serving as the new Director of Transportation in the city of Detroit. We really extend our best wishes to Dan for this important undertaking to try to save the public transit system in Detroit, especially in light of all the situations and difficulties that are faced there. We know that this has been an important week for Dan, but it's also great to know that someone of his skills and commitments is available to fight for maintaining and expanding public transportation in these most difficult of circumstances. So that's all I have for you right now today. I look forward to talking to you soon, and we'll be in touch. And I also look very much forward to seeing you next month in Florida, especially when you consider the kind of weather all of us have been appreciating throughout the United States. Thanks very much. Have a good weekend, and please have a joyful holiday in honor of the late Reverend Dr. Martin Luther King. Thanks. Talk to you soon. Bye for now.